Hi everyone, my name's Ashley Hines and I'm a process safety engineer working within WSP, a global engineering consultancy. Some of you may have heard me speak at Oil and Gas UK or step change in safety events in the past, or met me whilst I was an inspector with the HSE. I'm here to talk about barrier health and to offer some simple tips to help you keep an eye on the barriers at your workplace that help keep people safe. Part of my job as an inspector was to visit offshore installations and to check if the safety management systems were working as intended. Were they sufficient to keep people safe? I'd look at the safety case, read the procedures, visit the work sites, the control room, the permit office and so on. And crucially, I'd talk to people about their work and how they went about it. It was very rare that I wouldn't find barriers that weren't working as they should, or perhaps could be strengthened. Now, all of the companies I inspected had audit systems, but many of them failed to pick up on deficiencies in the barriers that my colleagues and I would find. There are lots of reasons for this, but I just wanted to share 3 tips that I think might help. Firstly, I can't stress highly enough the value and importance of good supervision in helping to maintain barrier health. The industry relies heavily on people doing the right things to prevent incidents, and supervisors can have a massive impact on this. They can help prevent hazardous mistakes by identifying gaps in team members' knowledge, understanding or motivation. They can make sure that procedures are being followed and care is taken. And they can help to maintain their team's morale and well-being. A good practice that I've seen is for supervisors to formally review their team's work list at the start of each shift. Pick out and record the highest risk tasks and set aside time to get involved with them, over and above any other priority they may have. Talk through the risk assessment or procedure. Check on people's understanding. Go and visit the job site a few times. Check that the procedure is being followed. And then invite and give people feedback on how it went. It's not a formal audit, but it's a great way to help supervisors show that safe working is their top priority, set the standards they expect, get to know their team's strengths and weaknesses, and help improve performance. The second area is around the audit schedule. Are you actually auditing the right things? The audit schedule might have been set for you, but does it feel right? Are there any tasks that you and your teams carry out that if they weren't performed correctly, or at all, could lead to a process safety incident? And are they subject to sufficient audit? I've never seen a company that doesn't have a permit to work audit system in place, for example, but I've seen plenty where they don't look at their systems for energy isolations or controls for reinstating plant, such as flange brake management, line walking or leak testing, or maybe even compliance with process operating procedures, such as startup of a well or a compressor. But if you think about it, these could be some of the most hazardous activities of all if you don't get them right. What have you got in place? Can you suggest any changes to the audit schedule to get better coverage of your risks? And my final suggestion is simply to go and look. For me, effective auditing of a system requires you to do 3 things. Look at the paperwork and records generated by it, such as a permit to work. Look at the work site and the conditions of the equipment affected by it. And crucially, talk to the people using the system. What do they understand about the task, the system, their role? What are the really important parts of the procedure? Is there any way it could be improved? So many of the audits I've reviewed over the years have clearly been completed at somebody's desk and based on just looking at the paperwork. If you just do this, you won't get a true picture of what's going on. And if you find something wrong, it won't necessarily be the full story or help you to understand what needs to be done to fix it. And you'll miss the chance to help influence the people that you're auditing. There's loads more that could be said on this, and I'd be delighted to hear from anyone who wants to discuss it further. But I hope this has been of some help. Thanks for watching and stay safe.